Good morning, and thank you very much for coming in, Wally.
Well,
okay, you and I go back quite a ways.
we do go back quite a ways, yeah.
I think 1985 makes it 37 years since you first had the cataract procedure.
Yeah, I think we did go back a little before that also.
Yeah, and
Late 70s, when you had dark hair.
and you had hair.
And I had hair.
I always found it, kind of ironic, especially lately, that a guy making health food like donuts, okay, made it into his 90s.
Well, maybe that's what did it.
So what were the reasons back then, if you recall, that you came in? What kind of problems were you having?
Just normal average checkup type of thing.
Mm-hmm.
And I really, I only had glasses to read with at that time. And then late 70s, I started to get a little foggy and blurry. The lights from the headlights of an oncoming car or a street light, they were like a big starburst. Mm-hmm. And I didn't think that was right. And they were a little bit on the blurry side during the day. So just, I knew there was something wrong there, so we check it out.
Yeah, no, we tried correcting you with glasses, and just up to a certain point, we just couldn't do that anymore.
Yeah.
So let's just go immediately after cataract surgery, and mind you, we did them a couple years apart, mm-hmm. as I recall, looking in your record. How did your functioning change?
Everything came back to normal and clear and exact and a little more of the perfection that I was looking for. So it's and it's to this day it's the same thing. It's just everything is nice and clear and vision is excellent.
Yeah, we've kind of followed each other around,
yes.
In this town. Yeah. You and I, having been here for that long, and so it's you really have maintained excellent vision, through all these years.
Excellent. Yeah. Yeah.
I think the last time I examined you was just a few weeks ago.
Right.
And we're still at 2025, 2020. Mm-hmm. So that brought us to doing the surgery in 1985 and 87. From looking at the record, as I see, that means these implants have been in place. I think you reminded me 37 years.
Yeah, that's right.
So that's kind of making us see as well as you are right into your early 90s.
Yeah, 92 so far.
Oh, I wasn't going to be precise.
Oh. Don't make any difference to me.
Okay. After surgery, what were your expectations, Wally? I mean, did you think you and I would be sitting here 37 years later?
I didn't think so, no. Might be over dinner somewhere, but but other than that, it's just everything came out so good, and the expectations were in good hands. So I thought, well, everything should clear up pretty nicely, which it did.
I mean, in the years that have passed, there's been all kinds of innovations that make this, about a 10-minute procedure now. The results, are just as good and, are similar to your own that you've had.
Results are great. In fact, we always kid when I sit down in a chair, you keep saying to me, geez, you still got those old things in there?
Well, what you're alluding to is, there has been great progress in the mm-hmm. implants.
Yeah.
And we have accommodative implants, we have multifocal implants, and what that means is the implants that are in use today really enable us to, do away with glasses completely in most instances, with good up-close vision, good intermediate vision, and excellent distance vision. The activity level post-operatively, did you feel like you were limited back in 85 and 87?
Not at all. After a day or two with the drops, and then a week or so back and forth to you to see you a few times. So the only difference there is that now pretty much instantaneously the next day you can resume normal activity because of the microscopic aspect of the incisions and the precision with which they're made. It was quick. I mean, the vision came back right away nicely.
It's good that you're remembering.
Yeah. Get to a point after a while you say, what?
Well, what you experienced post-operatively from this office, Wally, is high quality care. We call the patients several hours after surgery, as was done with you back in '85.
Yeah.
And that night, I also still call patients in the evening. Back then it was answering services. Now,
Yeah.
now everything's automated, and answering services weren't that reliable. So I was always concerned about a patient trying to get through to me or something in the evening, and you know, just kind of fell into calling everyone at night, which I still do to this day.
That part of the service, I think, is so important, and it's just part of being conscientious on what you do and so forth, and taking care of your patients. And we've checked every 6 months since then. So
Back then, we saw patients a little bit longer than we see them now. We see patients now the day after surgery. We see them a week later, a month later, 3 months later, and then the final visits with regard to the surgery before we fall to routine is 6 months and a year. So that's a little bit shorter than the 37 years that we've been following you. Thank you for entrusting your care to us. It's been a pleasure taking care of you. I think I can say that on behalf of all of the staff. You know, you're always so lively and upbeat, you know, coming in. You know, with people that are watching this that may be considering cataract surgery, you know, is there anything you can say, you know, in terms of
I would say
things
one
you
thing,
look for?
that when they get through with it, they're all going to say, I should have done this last year. And it's just, they put it off and put it off and put it off too long, and they should get it done right away, and you'd be so much satisfied with the results.
Wally, it's been a real pleasure having you here. I don't know if you're the longest implant we have in this practice, but you know, you're certainly very close
I
to
gotta
it.
be close, huh?
Yeah,
good.
when you reminded me of that a couple of weeks ago, I just feel very indebted to having had you as a
Well,
patient.
thank you very much. It's
Okay,
been my
and
pleasure.
really, thanks for coming in. Thanks
Yeah.
for making the time to do this. The staff has all
Anytime,
enjoyed
I'd be
it.
happy to.